Hi, Dr. McDonald. How are you?
Hi, I'm well. How are you?
Good. I'm really excited to chat with you today. So, before we get into it, I just want to do a quick introduction. My name is Kate Van Fossen. I work with psychiatric providers who have their private practices. And then, do you want to do a quick introduction for yourself?
Yeah, I'm Dr. Tamara McDonald. I am a doctor of nursing practice, and I'm dual board certified in family practice as well as psychiatry. And my practice focuses on mental health.
Well, I'm really excited to chat with you today because I know you just launched your private practice in Boise, right?
I did, yeah.
Great. So I just want to ask a couple of questions, get to know you better and get to know the practice better. So let's start with what inspired you to go into psychiatry?
It's a good question. I initially went to school to get my family practice license. And once I got done, I realized the overlap that there is in family practice and mental health, and that my true passion really lies in mental health. I see so often that our mental health and our physical health are part of our whole health, and there's really no separating them. And through that, I realized that my passion really is helping men and women reach mental wellness and well-being.
So let's pivot a little and talk about the patients that you do specialize in working with. Tell me about those patients.
Well, I work with both men and women ages 18 to 64, and I treat them for anxiety, depression, insomnia, post-traumatic stress disorder, or trauma. And then I specialize and am most passionate about working with women, still that same age range, so 18 to 64. And in that, what I focus on are the hormone fluctuations that we experience as women throughout our lifetime. So that could be related to the menstrual cycle. It could be polycystic ovarian syndrome, endometriosis. We know that there is a big overlap between our mental health and our hormones, as well as our physical health, right? And all of that matters. So when we look at the other end of the spectrum, perimenopause or postmenopausal women, that's a huge part of the population who is underrepresented in evidence, evidence-based studies and clinical trials, and really just good medical care. And not just medical care, but also psychiatric care. So understanding the changes that happen and how those affect both your physical and mental well-being is huge in helping people age healthily.
I love that. And that kind of leads into what I was going to ask you about next, because I saw, on your website that you're an integrative psychiatrist, which I don't think is always like commonplace or common knowledge amongst, patients. So tell me a little bit like what that means to you in your practice and why that's important to you to practice in that way.
When people look for a psychiatrist, what they typically find is somebody who specializes in medication management. This is wonderful, and we need this. Integrative psychiatry is a way of practicing that can include medication and includes all aspects of a person. So we aren't following specific algorithms or protocols. We truly are working to find what works best for the patient, and really that middle road between traditional medicine and then complementary or integrative medicine. And that's where integrative psychiatry comes from.
And I imagine just with your FNP background, there's so much that you bring into your practice from that experience. What are some of the different aspects or modalities that you offer?
So earlier this week, I was just speaking with a patient who was very medically complex, and being able to counsel them and help them understand their condition and also the treatment, the medical treatment that comes along with that, is so helpful for mental health. So with my medical background, I incorporate that. It's not necessarily a service that I promote, but that's just part of working with me as a provider, is that you also get that medical side, the medical understanding and knowledge if you need it.
Speaking on that, tell me what else is incorporated into your treatment plans outside of medication? Do you offer therapy? What else?
I do. I offer psychotherapy, cognitive behavioral therapy for anxiety, depression, and insomnia. We also will look at supplements that can help support your brain health, but also your overall health because of that mind and body connection.
Mhm.
And we'll look at your lifestyle. We'll look at diet, nutrition, just kind of these foundational things that help our body function optimally.
So I know you were also talking about personalized treatment plans. And I'd imagine, just speaking from a patient point of view, there's a big pain point of, traditional psychiatric providers just not having the time to maybe thoroughly educate or explain like what you were just talking about. So what does that look like in your practice in terms of the length of time that you work with patients?
Yeah, in traditional medicine, time is a commodity. It's always a limiting factor. In my practice, I chose not to accept insurance, so I'm private pay. For that reason, you know, that I get to spend more time with my patients, I can be more comprehensive about it, and we can talk about what's most important to them during those visits. I find that my patients respond very well to this. They're willing, to choose not to use insurance so that the quality of care and the time that we spend together can be increased,
Yeah.
rather than, you come in, I have 5 minutes with you, like most providers have with their patients, and you leave with a bunch of unanswered questions. And so that's the time that we spend focusing on what's important to them really builds value during our visits.
Yeah. And I know from, again, a patient's perspective, that's so appreciated to have someone who can really break things down in layman's terms and offer you, information and education outside of just what's happening from like a medication standpoint as well. I remember when we started working together as a woman in her 30s, your niche and specializing and working with that with women like really stuck out to me, because I think there's such a gap in the market for women who are struggling with hormonal related issues. And what provider do you go and see? It kind of ends up being, well, a little bit of PCP, maybe you're talking to your OB-GYN, maybe you're working with a nutritionist. But what I loved about the way you've shaped your practice is you've kind of created this one-stop shop for women where, again, like you said, you can address both the physical, but the emotional and the mental and even spiritual components of, how hormone dysregulation can throw off your life. So I love that about your practice, and that it really stood out to me. What inspired you to want to like specifically focus on the niche with women and having such a focus on hormones in your practice?
My journey into mental health started about 2 decades ago when I was a midwifery apprentice, and I have found such fulfillment in helping women through the pregnancy and that postpartum period. And I think that's always been there, and it took me, another almost 20 years to get back to making that into a niche where
Yeah.
I knew how I could provide, great medical care for these people. And I guess in the mental health side of it.
Okay, I love the way that you answered that, because you've been on the other side and you've served as, a midwife apprentice, and you've been there with the women. And it's almost like you recognize through that care the gap and the need for mental health support,
Yes.
during and after, and the role that, hormones play in that transition. And then, shaped your psychiatric career in this private practice to help serve those people.
Yeah, absolutely. And then for the hormone side of it in primary care, I am used to seeing women who kind of have these like vague complaints. And as I learn more about, the mental health side of it and the hormone replacement side of it, there's such an overlap in how that affects our overall health. And so that really brought in the passion for the other part, the other stage of women's life, right? And really helped me, I think, understand how important it is to provide that care, and how we really need more providers offering these types of services for women. Women experience life differently than men, and yet our traditional healthcare system, along with decades of research to guide care, favors how men experience the world. Hormones are essential to homeostasis in both men and women. So when we think about hormones, it's not just estrogen and progesterone, right? There's the thyroid hormone, there's adrenaline, there's cortisol, insulin, melatonin. And these regulate how we function. And if they're high or low, those can affect mental health as well. Although we think of estrogen and progesterone in women primarily, they also have testosterone, and it's as equally important for them as it is for men. So finding a provider who understands this and knows the most recent evidence on menopause hormone therapy, or it used to be called, still is called hormone replacement therapy, is important because there's a couple decades of women who have gone through perimenopause and menopause and haven't received any treatment. And they should, right? That should be part of good medical care. And those guidelines are changing. They're different than they were 20 years ago, and we're learning more things. So it's very important to find a provider who understands those hormone fluctuations during that time.
Yeah, that's so interesting. I've never heard a psychiatric provider speak so in
Yeah.
depth on, that being part of the picture. So it's so fascinating. I love that you bring that into your practice and support your patients with that as well. For any patients who are watching this right now and maybe struggling and are on the fence about reaching out for help, what would you say to them?
For anyone who's struggling with anxiety, PTSD, trauma, what you are going through or have gone through will always be a part of your story. And that's okay. It does not have to define you, though.
Mm.
The hardest part in any journey is taking the first step, and I invite you to do just that so you can heal and live that emotionally fulfilling and happy life that you deserve.
So if someone is interested in taking the next step with you, they really resonate with your message and you and learning more about you, what's the best next step for them to take?
They can book a free 15-minute consultation through the website, and I would love to learn more about you. You can also schedule that initial consultation again through the booking portion of the website. I'll send you intake forms and we'll schedule a time to get started.
Awesome. Well, thank you so much, Dr. McDonald. It was really great to chat with you today and learn more about, your background and the practice that you're shaping in Idaho. And I'm really excited to see this take off and for patients to find you.
Thank you so much for having me. I really appreciate your time.
Yeah, of course. We'll talk later.
Okay, take care.
Bye.